everybody, it's Rose from Sleepopolis. Do you snore or know someone who does? Many people think of snoring as just a normal part of sleep, but it could be a sign of sleep apnea, a common and potentially dangerous sleep disorder. In this video, I'll talk about what sleep apnea is, how it affects your sleep, and how doctors treat it so you know what to watch for, particularly if you snore. By the way, if you have any questions during this video, feel free to post a comment below and I'll be glad to answer it. So you may be wondering, what is sleep apnea? Well, sleep apnea is a disorder that causes a pause in breathing during sleep. That's what apnea means, a pause in breathing. Breathing can stop for at least 10 seconds and can stop 100 or more times an hour. Sleep apnea happens when the airway is blocked, usually by the tongue or tissue in the top of the mouth, or when the brain doesn't send the right signals to the muscles that control breathing. The most common symptom of sleep apnea is snoring. Now, many of us think of snoring as a natural part of sleep, but it usually indicates a problem with the airway or, less commonly, the brain. Other symptoms include daytime sleepiness, waking up a lot, or gasping and choking during sleep. Most people think of sleep apnea as a disorder with a single cause, but there are three types. When the disorder involves the airway, it's called obstructive sleep apnea, or OSA. When it involves the brain, it's called central sleep apnea. And when it involves both, it's called complex sleep apnea. Now let's take a look at each of these in depth and see how they're different from each other. Obstructive sleep apnea, OSA, happens when the tongue or airway muscles block the throat. The risk of OSA goes up if you're over 50, smoke, or have high blood pressure. And you're more likely to suffer from sleep apnea if your neck circumference is 15.75 inches or more, especially if your BMI is high. Enlarged tonsils and nasal congestion can also block the airway, and a small jaw can cause the tongue to drop into the throat during sleep. Lying on your back can cause OSA or make it worse. Central sleep apnea involves a failure of the brain to send the right signals to the muscles that control breathing. This can be caused by medications, high altitude, or conditions like heart failure or stroke. It can also be caused by using a CPAP machine, which treats sleep apnea by blowing air into the lungs. This is called treatment-emergent central sleep apnea. Complex sleep apnea can result from congestive heart failure, medical conditions like kidney disease, and certain drugs. Narcotic pain medication can stop the brain from sending out the right breathing signals and cause obstructive sleep apnea by relaxing the tongue and palate muscles. Now for the effects of sleep apnea. I've said the disorder is potentially dangerous. Even mild sleep apnea can cause daytime sleepiness and trouble with learning and memory. Severe sleep apnea can cause diabetes, stroke, or heart attack. Why are these effects so severe? Well, lack of oxygen can cause chronic inflammation that leads to cardiovascular disease, while lack of sleep causes metabolic changes. Sleep apnea can also drive certain cancers through its effect on the immune system. So if you suspect you might have sleep apnea, it's important to get diagnosed and treated. Which brings us to how sleep apnea is diagnosed. The best test for sleep apnea is a home or laboratory sleep study. These studies measure apneas, which are pauses in breathing, and hypapneas, which are episodes of slow or shallow breathing. A laboratory sleep study also records brain waves and limb movements and requires spending a night in a sleep lab. A home sleep study is conducted at home and then sent back to the sleep study company to interpret. Before we get into treating sleep apnea, a quick note. Our content and videos are meant to be informative, but they shouldn't take the place of care by a trained professional. If you feel you might be suffering from a sleep disorder or other medical condition, see your healthcare provider. Now let's talk about treatment. Sleep apnea can be dangerous, but there are effective treatments. First is the CPAP, or continuous positive airway pressure machine. Now this is the gold standard of sleep apnea treatment. A CPAP applies gentle air pressure into the blocked airway, allowing oxygen to enter the lungs and improving the quality of sleep. Oral appliances are another type of treatment for sleep apnea. They fit like a mouth guard and pull the jaw and tongue forward. They're usually custom fitted by dentists who specialize in sleep apnea treatment. I asked Dr. Jeff Rogers, a specialist in dental sleep medicine, if these devices are appropriate for any type of sleep apnea.
The oral devices are really just used to treat obstructive sleep apnea. There's two kinds, basically, well, there's a few kinds of apnea, but central and obstructive. Central is where, for some reason, you're not making an effort to breathe. The oral devices is really not appropriate when you have primary central apnea. but the vast majority of people with apnea, it is obstructive apnea, and the device can work great for that.
Now, some oral devices are available without a custom fitting and at a lower cost, but have a one-size-fits-all approach. I asked Dr. Rogers if these devices work better when they're custom fitted or if it's okay to buy them online.
The online appliances really typically do not do very well. The success rate of those is very low. The problem with them is that they don't fit well when you're dealing with a one-size-fits-all appliance. Custom fitted obviously is going to fit you much better. It's like going to a tailor to get your suit made. It's going to be made specifically for you. They're more retentive, and they've also got an expert helping you figure out where to position the jaw to help open the airway.
For people with sleep apnea who can't tolerate other treatment, surgery can be performed to remove excess tissue from the tongue or pharynx, straighten the septum, or reduce the size of the turbinates, which are structures that help humidify and clean the nose. Bariatric surgery for weight loss can also improve or eliminate sleep apnea. This is typically a surgery of last resort unless the patient requests it for purposes of weight loss in addition to sleep apnea treatment. So there you have it, the basics of sleep apnea. If you'd like to learn more about this disorder, check out my article linked below. And if you found this video helpful, be sure to like and subscribe to our channel and follow us on social media. Until next time, see you later, Sleepopolites.